Good day everyone. My name is Juan Miguel o Apat, and today I am going to perform Peripheral Vascular System. Procedure number 1. Assess the client's physical and psychological aspect before and during the examination. For the rationale, allow healthcare provider to gather complete data about the client's health status. So good day ma'am. How are you po?
I'm fine.
Thank you. Next, procedure number 2. Review the body areas to be examined. Rationale, health examiner, to identify which part of the body is to be examined systematically. Next, procedure number 3. Make a physical and environmental preparation before examination. For the rationale, proper preparation of environment, client, and equipment ensure smooth physical examination with few interruptions. Next, procedure number 4. Gather and take the health history of the client. For the rationale, to have a comparison from previous illnesses and present health condition. So good day ma'am, may I ask kung meron po kayong sakit sa puso?
None.
Ubo po.
Wala din po.
Thank you po. Next, procedure number 5. Conduct a physical assessment of the peripheral vascular system using the first skill in assessment or IPPA, inspection and the palpation. And for the rationale, to assess, determine, and identify abnormal findings in the cardiovascular system. Now, for the peripheral pulse, procedure number 6, we are going to palpate the peripheral pulse on both sides of the client's body individually. And for the normal findings, it should be symmetrical pulse and full pulsations. And for the abnormal, asymmetric volumes indicates impaired circulation, absence of pulsation or indicates arterial spasm or occlusions, and decreased weak pulsations. So, good day ma'am. I-inspect ko po yung peripheral pulse niyo po. Ma'am, okay lang po ba?
Okay.
So, ipalpit lang po natin yung... Thank you. Next, for the peripheral veins, procedure number 7, we're going to inspect the peripheral veins in the arms and legs for the presence and appearance of superficial veins when limbs are dependent and when limbs are elevated. And for the normal findings, independent position, presence of distension and nodular bulges at calves when limbs are elevated, veins collapse. Veins may appear distended in older people. And for the abnormal, distended veins in the thigh and lower leg or on the posterolateral part of the calf from knee to ankle. So, i-inspect lang po natin ano po. Dito po. Kabila. Kabila. Thank you. Next, assessment of the peripheral legs for signs of phlebitis. For procedure number 8, inspect the calves for redness and swelling over the vein site. And for the normal findings, it should be or it should not have redness and swelling. And for the abnormal, swelling of one calf or leg or both. So i-check lang po natin ang calves ni po, ma'am. Bila. Thank you. Next, procedure number 9. We are going to palpate the calves for firmness or tension of the muscle, the presence of edema over the dorsum of the foot, and areas of localized warmth. For the normal findings, there should be no edema and calves are firm. And for the abnormal, warmth noted and positive edema in one or both legs. Palpate lang po natin ang calves niyo po, ma'am. Kabila ba? Thank you. Now, for procedure number 10. Push the calf from side to side to palpate for tenderness. For the normal findings, limbs not tender, and for the abnormal, tenderness on palpation. Now, for procedure number 11, firmly dorsiflex the client's foot while supporting the entire leg in extension. Human stance or have the person stand or walk. For the normal findings, pain not noted on dorsiflexion. And for the abnormal, pain in calf muscle with forceful dorsiflexion of the foot and positive hormones test. So, straight lang po natin yung paa natin, ma'am. So, magkakanda po kayo ng hormones test po, ma'am. Sabi ka lang po, ma'am, kung masakit po or hindi.
Okay.
Sakit po ba?
Hindi po.
Kabila. Sakit po.
Hindi po.
So, pwede po kayong tumayo, ma'am. Ang sakit po ba?
Hindi.
Sige po. Next. Next for the peripheral perfusion. Procedure number 12. Inspect the skin of the hand and feet for color, temperature, edema, and skin changes. For the normal findings, the skin color should be pink, and for the abnormal, cyanotic, venous insufficiency, pallor that increases with limb elevation, dependent rubor, a dusky red color when limbs are lowered, indicating arterial insufficiency, and brown pigmentation around ankles, indicating arterial or chronic venous insufficiency. Check lang po natin yung kamay niyo po, ma'am. Sa paa po. Thank you. Next, procedure number 13. Palpate and check the temperature. For the normal findings, skin temperature not excessively warm and no edema. And for the abnormal, skin is too warm or too cold, and there's a presence of edema. Okay pa temperature na ito. Next, procedure number 14, palpate and assess for the adequacy of arterial flow. For the normal findings, skin returns to normal color after pressing the palm of the hand. And for the abnormal, delayed return of the color of the skin. Skip mo pa ito naman. Now for the capillary refill test. Procedure number 15. Press at least one nail on each hand and foot sufficiently to cause blanching, about 5 seconds. Then release the pressure and observe how quickly normal color returns. And for the normal findings, color returns immediately, less than 2 seconds. And for the abnormal, delayed return of color more than 2 seconds, indicating arterial insufficiency. Next, procedure number 16, inspect the fingernails or chains indicate or circulatory impairment. And for the normal finding, it should be pink in color. And for the abnormal, bluish discoloration indicating cyanosis. Pale may indicate occlusion or occlusion in arterial and venous flow. Now, for the evaluation, procedure number 17. Make findings on health assessment and physical examination done on the client. For the rationale, these are important data to convey the physician aid in diagnosis of the patient. And for the documentation, record, document, and report any pertinent findings during the assessment to appropriate personnel. And for the rationale, to provide accurate data in the care of the client. So tapos na po ang ating ano po ma'am, ating assessment po ma'am. Ano pong nararamdaman niyo po ma'am?
Wala.
Wala. So thank you po ma'am for the cooperation. Thank you. Now, the assessment of peripheral vascular system is already done. Thank you for watching.